It's now time to take a look at news stories making headlines around the globe today. Now, the Nigeria Center for Disease Control have reported 4 new deaths and 195 fresh new cases of COVID-19, bringing the total infections in Nigeria to 1,532. Announcing this early on Wednesday, the Nigeria Center for Disease Control said Lagos have recorded 80 new cases, Kano 38, Ogun and Bauchi 15 each, Borno 11 cases, Gombe 10 cases, Sokoto 9, Edo and Jigawa 5 each, Zamfara 2, while Rivers, Enugu, Delta, Nasarawa and the Federal Capital Territory 1 each. Now, the NCDC have also said that 255 persons have been discharged thus far, while 44 have unfortunately lost their lives. So, Doctor, there we have our largest increase in the space of 24 hours that we've seen so far, 195 new cases. Kano is back on the radar, which means that they have a lab that is up and working and functioning again. But also, it would be a good question to ask what the testing capacity had been in that lab, because the figures that we got from Kano are quite, I would say low compared to what we would have expected, given the fact that we didn't have tests coming out for quite a few days. But this is definitely quite worrying. It's worrying to see more deaths. It's worrying to see the fact that 33 states are now infected with the virus and it's spreading. Analysts are asking whether the easing of the lockdown on Monday in Lagos, Ogun and the Federal Capital Territory is still a good idea. And once again, people are just stuck for answers.
Well, you're right. The numbers continue to increase and it's very frightening. Ihe Kwazu, the CEO of the Nigeria Center for Disease Control, says that so far Nigeria has conducted up to about 12,000 tests. But he then emphasized that we need to still do a lot more testing. From initial excuses about testing, we now find, the relevant officials insisting that we really need to test a lot more.
Yeah.
And he is saying that he is looking forward to about 2 million tests within 2 months, and that on the average, in every state, the NCDC would like to see up to 50,000 cases, tested. Now, at the moment, if indeed it is true that we've done about 12,000 tests, those who have looked at the figures say that 14%. The infection rate is 14%, yeah. The death rate is 3%. Now, if we succeed in doing 2 million tests, then, of course, at the present rate, you'll be looking at a total of about 280,000 infected cases. And you could have deaths also running into thousands.
Yeah.
And that's why, some analysts have said that the easing of the lockdown may not, really be in anybody's interest. But the Minister of Health, Ehanire, has pointed out that, well, we really don't have the social structure to be able to have a prolonged lockdown. Boss Mustafa, who is the head of the Presidential Task Force, says, well, with the easing of the restrictions, beginning from next week in Lagos, Ogun, and the FCT, that a lot of people will have to fall back on their own personal responsibility. Now, you know how Nigerians have behaved even during the process of the lockdown. Whether we can count on people taking responsibility for themselves, well, we probably still need to do a lot more in terms of public sensitization. Now, to go back to the figures, the total number of confirmed cases in Kano now is 115.
Yeah.
So it has jumped since the testing started again from 73 to 115. But of course, the more you test,
the more
the more figures you get. But also worrisome is the fact that we are now having more cases coming out of Borno, Bauchi, and parts of the north, and also Gombe. Now, what is worrisome about these states is that these are states where you have internally displaced persons camps.
Yes.
Now, if there is a major outbreak in those internally displaced persons camps, then we will find ourselves in a very, very serious situation.
Absolutely.
But in spite of all of this, in the other news, Chikwu Ihekwazu says that the number of Lassa fever cases have, the number has reduced in the last 3 weeks, and that, it's gone below the emergency threshold, even if we recorded in 27 states up to about 188 deaths, and in total, we had 979 confirmed cases of Lassa fever. So if Nigeria has been able to, ensure the control of the spread of Lassa fever and keep it below the level of an emergency, that probably should give us hope that if we keep doing the right things, then we may well be able, at the end of the day, also win the war against COVID-19. Also, on the positive side, yesterday we were told that President Buhari had a telephone conversation with President Donald Trump of the United States, a conversation in which both leaders exchanged pleasantries and commiserated with one another. And at the end of the day, with President Trump promising to send some ventilators to Nigeria. We've also received support from the German government as part of the Nigeria Humanitarian Fund that is managed by the UN Office of Coordination of Humanitarian Affairs in Nigeria. And that's about 5.5 million euros, bringing to a total of 29 million euros that have been contributed so far by Germany to that fund. So I think we should thank Germany. Another good news, a group of researchers at the University of Benin, led by Professor Kansintin Obahiagbon, have succeeded in producing a ventilator that they say can work for a whole hour, even without electricity. So that's the kind of effort we'd like to see coming out of our universities, our researchers. The other day, it was the military through Daikon that also produced ventilators. So the research component of this battle that we've been focusing on, I think it's something that should be important, that should be taken seriously. And the researchers at the University of Benin and other researchers elsewhere in Nigeria should be given the necessary support.
Absolutely. I couldn't agree with you more on that point of research. And also, speaking of research and looking at the effects of the lockdown as well, it would be good to see a lot of research going into whether the lockdown may have also contributed maybe to the rise in numbers that we're seeing because of Nigeria's social structure. There's so many unanswered questions that we still don't know, and it'll be good to get those answers. So yes, research, and more research. Now, next Monday, we're going to see the end of the lockdown restrictions, as we've stated, both in Lagos and Abuja and Ogun. Now, instead, countrywide measures will come into effect, including a curfew, a nighttime curfew, and mandatory face masks. My colleague, Amaka Ude, had spoken to the Nigerian Health Minister, Dr. Osagie Ehanire, and asked him if people's health was being jeopardized for the economy, and here's what he had to say.
Decision, you have to walk a thin line between what you call jeopardizing the health, which may not necessarily be that, and also the livelihood of Nigerians. As you know, a lockdown has a devastating effect on the economy, on social life, and on the livelihood of many people. There are lots of results of the effects of this lockdown that are not too good. So you have to take a very difficult decision indeed between what to do to get continue to get the health side of it right, and also to try to ease the economy so that people can make a livelihood that they are used to. We do not have the very social structure of other countries who are able to take care of all citizens in such a difficult emergency. We're not structured that way. So it is a difficult decision, and I think the right decision has been taken by the president to ease the economy a little bit, and at the same time put a very strong searchlight on the health side.
Health Minister Osagie Ehanire will go on a very quick commercial break, and when we are back, the conversation continues. Stay with us. Welcome back to the morning show here on Arise News. We're now joined by business correspondent Rotus Odiri for the latest headlines in the business world. Good morning, Rotus.
Good morning, Leila. Good morning, Dr. Abasi. So big news. We got our loan approval from the World Bank, from their RFI, their Rapid Financing Instrument, which was set up for a number of countries to quickly get financing in order to combat COVID-19. We're looking at Kristina Georgieva. Love her name. She's a Bulgarian economist and the managing director of the World Bank. Sent out a tweet, of course, saying that it had been approved. Also got a tweet from the IMF. And of course, to back up though, we have an outstanding loan request, 6.9 billion in total. So 3.4 billion from the IMF in dollars, 2.5 billion from the World Bank, and 1 billion from the African Development Bank. So those are the requests. Of course, the 3.4 has been approved from the IMF. So the IMF put out the notification yesterday that the executive board had approved the funds. Georgieva said that, of course, that we support Nigeria's efforts to limit the effect of COVID-19 and the sharp fall of oil prices, and that the 3.4 billion approved by the board is the largest IMF COVID-19 emergency financing provided till date. And it's going to help Nigeria free up resources to protect lives and livelihoods. So very, very important. I do have to throw in an additional quote. There was a statement released by the IMF, and within that statement, press release, was a statement from Mitsuhiro Furusawa. He's the deputy MD and acting chair of the IMF. And he said the authorities' immediate actions to respond to the crisis are welcome. The short-term focus on fiscal accommodation would allow for higher health spending and help alleviate the impact of the crisis on households and businesses. But very crucially, highlighted there, he threw in this. He said, steps taken toward a more unified and flexible exchange rates are also important, and unification of the exchange rate should be expedited. Now, we should remember that the RFI doesn't come with any conditions, so Nigeria doesn't have to listen to any of what he's saying. But he did throw that in to say that this is something that the IMF would like to see. We have taken steps towards a more unified exchange rate with the technical devaluation that already happened, moving from 306 to 360 official rate and then 380 on the INE window. So those steps are being put into place. The question now is, of course, getting the remaining funding from the World Bank and the AFDB. And then should we need more funding, where do we move from there? If we, of course, the Minister of Finance has said already that Nigeria is not going to be approaching the IMF for any formal loans, because if we were to do that, there would be more stringent requirements attached to it. But by and large, for now, we've got the funds. When you think about the efforts the CBN has put in place to cut COVID-19, the coalition with the private sector, what they put together for the ICUs they built, feeding of the poor, and the need for these additional funds to assist the Ministry of Finance's $500 billion COVID-19 crisis funding. This is a great step. I mean, it's the largest fund that's been approved. So
this is brilliant.
Well, even before COVID-19, we had very serious issues with the Nigerian economy, either in terms of sustainability of our debt, or in terms of financing gaps, or in terms of real GDP growth. Then, of course, the crisis, the international crisis, the demand and supply crisis in the international oil market, COVID-19 further complicated our situation economically. And of course, it's not only Nigeria that is affected. Every country is looking for a way out. And it's very good to see the Bretton Woods Institution, IMF and the World Bank providing support, not just in terms of helping countries to address their financing gap, but also in terms of debt relief. Before now, IMF had approved debt relief for 25 countries, most of them in Africa and the Middle East. Also, in addition to what has been done for Nigeria, IMF is going to release an additional $18 billion for up to about 40 countries in Africa. But let's come back to Nigeria. You recall that about a month ago, as part of a way out of the crisis in which we have found ourselves, the Minister of Finance said we're going to take this facility, the RFI, which comes without any strings or conditionalities. It is a special drawing right, and we're taking 100% of quota. Now, at the time, people had said, well, why are we withdrawing 100% of quota? But the Minister of Finance had said, well, it's up to the IMF to either approve everything as requested or a part of it. But I think that the IMF board, in assessing Nigeria's situation, decided to release this money. And the money, of course, will help to address the large financing gap that we have. It will help us to address our balance of payment issues. It will also provide an opportunity for the monetary authorities to be able to stabilize the foreign exchange. You quoted some figures the other time, but the truth of the matter is that in the parallel market, the exchange rate is about 450, to the dollar. It's not exactly what we're expecting. But more of all of this, apart from addressing these contractions within the economy with the head of this tranche of money, which will be released, we're told, quickly, before the end of the month.
End of the month,
Now, there are other issues highlighted by the IMF, what Nigeria needs to do in the short term.
Right.
They drew attention to certain things, macroeconomic stability, getting our priorities right, and then planning ahead, and then providing the necessary support for critical sectors of the economy. And in that regard, one of the proposals of the IMF is that it will be available to provide technical support in policy areas. I hope we take full advantage of this.
Certainly.
And then the additional thing, of course, is that the Senate yesterday approved, is it the 850 billion
yes.
Loan that Nigeria wants to, but that's not going to be an external borrowing loan again. It will be domestic.
Yes.
And the capital market in Nigeria, the domestic capital market, we're told, can make
support that.
Available at low interest rate.
Cheaper than borrowing.
So it's not a new loan
yeah.
because it was originally in the 2020
budget. Yes.
It's the sourcing of it that has been changed and approved by the Senate.
Good times. Good times. We need to utilize the funds and make
Certainly.
sure.
Thank you very much,
Thank you for the updates this morning. We'll see you tomorrow. That's all on this segment of the morning show. We'll take a short break now, and when we're back, we'll be joined by Aaron Akerejola for some updates on coronavirus. Stay with us. Welcome back to the morning show here on Arise News. We're now joined by Aaron Akerejola for updates on coronavirus around the world. Good morning, Aaron. How are you?
Good morning, Leila.
Good morning.
Yeah, good morning, Doctor. And we started off with the figures. Of course, we know that the figures as of this morning, we can see the live numbers there on your screen. Of course, well over 3,117,000 now. It's actually gone up from 3,116,000 at the moment as we speak. But let's focus on Africa, where Egypt right now has the most numbers, with 5,042 cases recorded in Egypt, while South Africa comes a very close second. 4,996 is the number there. Morocco third with 4,252 before the likes of Algeria with 3,646. And also not forgetting countries like Cameroon, 1,806, and Ghana, all right, making up the top 5 nations that have actually witnessed more incidences in terms of COVID-19 as we speak.
And it's quite worrying because what we're seeing in Nigeria, like Doctor and I were discussing on the show earlier, is that the more our testing capacity goes up here, the more cases we're seeing in Nigeria. We had our highest rise in 24 hours. Yeah. And that means that very soon what we're possibly going to be seeing is ourselves in those top 5 figures.
Well, I mean, the figures are rising, and the big fear is that, many of the countries that are planning to ease restrictions, like France, like Italy, like Spain, even the United Kingdom, where that is part of the debate, and even in the United States, where in the state of Georgia, beauty parlors, barber shops, and tattoo parlors, have reopened. Beaches and restaurants are now opening in the state of Georgia. But the fear about, the lockdown, if you relax it, is what follows. Are you likely to have a second peak? And one of the suggestions that have been put on the table is that you have to do a lot more testing. In fact, in the UK, that's the big issue today, about how to provide, to ensure that over 65-year-olds have access to testing. Home care centers, elderly care centers also have access, And I think the Sun in the UK today is saying testing. Yeah. And all of that is in spite of the fact that, more people have died in the city of London than they did when Hitler's forces attacked London during the World War II. In the United States, with 59,000 cases of death and over 1 million confirmed cases. Now, more persons have died from COVID-19 in the United States than was the case during the Vietnam War. So the world faces a very serious challenge, but, policymakers, political leaders, just have to tread cautiously about how, they ease, the restrictions. But, of course, in Nigeria, as Ihekwazu has pointed out, we need to do a lot more testing. And I hope that he gets the kits that he has been talking about to be able to fast-track that process.
But what do you think? Because countries that have also been able to ramp up their testing seem to be countries that are coming out to mention that they're easing lockdowns. And this could also be to do with the fact that because of your testing capacity, you're at a point where you can project and foresee what coronavirus is going to bring to your country. So you can say, you know what, okay, let's open up the economy. At the end of the day, like our guest said yesterday, coronavirus is here to stay. What is your opinion?
Well, I mean, the thing, as I said, is to tread with caution. The rule that has been articulated in the UK, for example, by Matt Hancock, the health secretary is, one, to make sure that the UK does not experience a second wave, and two, to take precautions to ensure that the NHS is not overwhelmed. So every country will design its own strategy and response to ensure that, in trying to open up, you don't then kill more people.
But New Zealand have actually led the way in terms of some of those things, because they feel that at the moment they're on top of the situation, and they've been able to envisage what it will look like probably weeks down the line, and that is why they are now easing restrictions on some of these places. You've mentioned pubs, you've mentioned bars, you've mentioned restaurants, and
thanks, Aaron.
Thank you, Aaron.
All right.
Thank you. We'll see you tomorrow.
Okay.